88%, so 220 executives from health systems said they believe commercial payments need to grow to support long-term financial health. That's interesting to me, because I think that's flying in the face of what I believe is going to happen, which is we have such pressure against the growing cost of healthcare across the board that their health systems need to find another way to be financially healthy. And one of the things I've always talked about, and I always wondered, is in every other industry that we were in, we've seen technology come in and really drive significant efficiencies, cost savings, efficient processes, driving better collections, you name it. It's really helped the overall process. But in healthcare, it just seems to pile on and build the cost, but doesn't seem to drive that same level of efficiency as it does in other industries. Has that been your experience, or are we starting to see that change a little bit?
I am lucky enough to have been involved over the course of my career in Toyota lean production systems, sort of thinking at a couple of my organizations, and just thinking about performance improvement and process improvement and how much waste there is in the system currently. And a lot of that is driven by bureaucracy and the reality that in many healthcare systems, physicians are not employees. And so we have a tendency to bend and flex and try to accommodate them, which means that we do things that may not be the most efficient things in the world. And that isn't just from an IT perspective, that includes things like orthopedic fixation sets that we use in the OR. We make lots of exceptions and do lots of things that are inefficient because we want to the primary producers in our organization happy. And it's not just that, it's lots of other stuff. So the system is kind of built to encourage us to be inefficient. And our tendency, I think, growing up in healthcare is to think that our inefficient processes are the best practices in a lot of ways, which encourages us to ask for more money, not to look internally at how we do things and see how we could be more efficient. I think there's a lot of efficiency still to be gained inside of the delivery of healthcare, both on the clinical side and the business side, and even in research. And I think we're going to get the pressure to make that internal look happen and to become more efficient, because if we don't, I think you create the situation where you become the target to be acquired as opposed to being the acquiring organization. So the decision ultimately is yours, I think.